Hi, everybody. My name is Suzana Marku, nurse practitioner and co-founder of Your Formula.
And I'm Dr. Jonathan Zaidan, board-certified physician, co-founder of Your Formula.
So, Dr. Zaidan, I know we have a very interesting topic today. Has a lot of buzz around it. GLP-1s, okay?
Well, not everybody's going to know it as GLP-1.
True.
Right? Some people are going to hear about semaglutides.
Correct.
What's the difference?
Right. And they might hear about its alternative, right? Tirzepatide.
Correct.
Correct.
Are they pretty much the same?
Very similar.
Okay. I'm going to go crazy now, right? Because of everyone that talks about peptides.
Yeah.
Everybody's listening to us probably has heard about peptides by now.
Correct.
Right? I mean, that's our patient population, right? They're constantly talking to me about it. Name a very common peptide.
Semaglutide. I would say that's probably the most common if I had to hear about it.
Do you know why I just did that?
Because a lot of patients don't know that it's
either I had a huge muscle spasm or nobody knows that.
Yeah.
People are coming to me, talking to me about GLP-1. Like they know everything about it.
Yeah.
And then they tell me in the same conversation, well, I don't mind taking that, because, I know that's safe and everything, but I'm never going to take peptides. And I literally I did it. That was unnatural. I mean, that was the most natural response because that's exactly what I do when I talk to them. I just kind of go,
GLP-1 is glucagon-like peptide 1. That's exactly what it is.
I will never take peptides. I'll take GLP, glucagon-like peptide 1, because that's safe.
Yeah, I know.
Familiarity, right? They've heard it so much, they believe it to be true.
So what's great about this podcast, though, and about our conversations is that it's going to be conversational and educational, right? So
what's great about this is, honestly, maybe some of these people are asking me this stuff when I don't want them to ask me because, I'm busy, just like everybody out there. Every one of you guys is busy. I don't have time to answer the same questions over and over again. I'm going to be like, why don't you watch my podcast?
We go over it in great detail.
Then they'll tell me I don't have time.
Yeah.
I'm too busy.
So I think the most important question should be, right, or maybe the first thing that we should start off with is, what do GLP-1s do?
They do so many things, but I'm gonna deflect that question back to you.
Okay.
Because really, it is a natural gut hormone.
Yes.
And that is really what it's doing, the natural thing that your gut should do. But what we're allowing, a GLP is allowing you to feel better satiety.
Correct.
Right?
Yeah.
You feel a little bit fuller. It slows your gastric emptying. It helps your gut metabolism. So those are the things that it's doing. There's some side effects to that.
Yeah.
What are those side effects?
So I always tell patients, and patients who are listening to this that I've seen in office, I always say, depending on the mechanism of action, right? So we talked about how it works in the gut, right?
Right.
That directly correlates with its side effects. So
no doubt.
For example, if we know it's working on the gut, we know that there can be some nausea, there can be some diarrhea, some constipation. I will say that tends to be the number one, the top 3 main concerns. But obviously,
let's back up a little bit, because a lot of people don't understand, the leap between the medicine, the product, and then this nausea, constipation, and diarrhea. They ask me a lot about it. It's slowing your gastric emptying. It's changing a little bit of your metabolism. So the nausea, right, is because you're not bringing that down, the food, the liquids down as fast. So you're not used to that. So early on, you get it even more. You're going to get that nausea because you feel like, hey, things are still in my stomach, and you're not used to that.
Correct.
So that's number one. And then the diarrhea or the constipation is because now that material has been sitting for a while and it comes through and it's metabolized a little bit differently. And depending on your gut, it may go through a little bit faster. It might go through a little bit slower. You might absorb a little bit more water. You might absorb a little less water. And as a result of that, instead of getting completely well-formed stool, you're going to get either maybe a little bit of a diarrhea or a little constipation. Now, I want to make sure that people are aware. Not everybody gets that, right? I mean, a good majority of people do not get that. And it's, pretty easily managed with their diet and everything else. But it's something that people need to realize.
Yeah, absolutely. And I think since we're on this topic, another thing that I have seen over the years, and I think a lot of people are talking about, is muscle wasting. They're concerned that if they take a GLP-1 that, oh my gosh, yes, I'm going to lose, potentially all this weight, but I'm going to potentially lose all my muscle mass. And I think it's important because what we just described as the GI side effects, see, that is a direct correlation. When it comes to the muscle mass, a lot of that's preventable.
Oh, yeah.
With a high protein intake. Yeah. And prioritizing, hey, I'm going to go to the gym. I'm going to do strength training. I'm going to do resistance training. So a lot of the concern that we hear on like the muscle loss, see, that's secondary to a low caloric intake. That's not directly related to an actual GLP-1.
Well, there's no doubt about it, right? So as you decrease your overall intake of food because you feel full, you feel all of those things, right? Your body is going to metabolize things a little bit differently, and it's going to start to take protein from other places, and that would be your muscle. And I think that, never underestimate, I think some of the cosmetic effects of these GLP-1s, I think that's a side effect. I think, it's not something that you're going to see in a textbook right now, but I mean, people are starting to come into, my office or, they talk to me when I'm at, social events with my wife and they want to talk to me about this stuff. And they say, well, I don't want to look like one of those people that took one of these drugs. And I don't want to mention those drugs by name. They took a semaglutide, but they mention them a lot of times by name because they were given it by somebody as a prescription and they're taking it and they don't want to look like that. Well, the reason that people look like that is because that's all they're doing. They're not really getting it by, someone like your formula who's going to make sure that their diet is good, make sure they're on a regimen for exercise, make sure of all of those things as we are, taking your intake questionnaire and your follow-up visits and, taking all your labs and all the things that we're going to do to monitor you through this process. We're going to be constantly, getting you to that point. Many people are just getting these drugs either online, which just kills me. I mean, these are people that are very educated, people that are buying stuff from people there's no way they could trust. They're not at PCAB accredited pharmacies.
There's a lot of patients that have told me that they just bought it online, like in a cart, like for $40. And I'm like, I don't know what you're getting, but it is definitely not sterile, PCAB accredited, approved.
Some of the people that are doing that, Susie, I can't even tell you. It makes no sense to me. These are people that are using hand sterilizer before they're going into the bathroom. They're very type A people, but they don't know a lot about this. And they saw it online and they thought, hey, I'm going to try it. And maybe it was at a good price point. Usually it's an introductory price point. It's not the regular price point. So they go through it and then they're still using it. And then they're not getting a good outcome because they're not doing all these other things. And muscle loss is big. I mean, you've got to be eating a high protein diet. You've got to be exercising. And these are the things that I think your formula is set up to, this is why people come to us now.
Yeah.
Right? I mean, this is why they come to us. I mean, we don't have to say anymore. I mean, we're trying to educate people when we do these podcasts, but the truth of the matter is we're educating all of our patients, and that's why they're doing so well.
Absolutely. Thank you so much, Dr. Zaidan.
This is, a pleasure. I mean, our job at Your Formula is to make sure that people get the right formula, the right medications, the right treatment plans, the right exercise programs, the right nutritional programs, so they can be their best them. And that means that we have to create their formula for them. The right formula is your formula, not a formula, not a formula that benefits whoever prescribed it to you. It's your formula, and that's going to require a lot of effort. So if you're going to be a, your formula patient per se, the first thing you need to think of is, am I willing to put in the effort?
Yeah.
Thanks.